So this session is dealing with national physical activity plans. In thinking about a mechanism to introduce this, I think we probably would agree that just prior to the Atlanta Games, when the US announced its national physical, or the Surgeon General's report on physical activity and health, governments from around the world sat up and took notice. I can tell you from personal experience working here in Ontario in the provincial government back in those days that a management board analyst and a cabinet submission that we had put through for funding was rejected in the late 80s into the early 90s because in their view, and these people are lawyers, they're not exercise scientists, exercise physiologists, or public health people, but in their view, the evidence was not substantial enough to warrant public funding being put in to promote health-enhancing physical activity. And as a result of that, we were, at least in Ontario here, delayed several years in implementing some of our plans. But when the Surgeon General's report came out, things changed again. And when governments looked at a public policy perspective in this area, when the WHO Global Strategy on Diet and Physical Activity was released. And over the last few years, we've seen the meeting in New York that looked at the whole area of physical activity as a substantial intervention for reductions in chronic disease has had an impact. So when we look at that and then we think about the Toronto Charter that was developed at the Third International Conference on Physical Activity and Health and ratified by about 1,100 folks just down the road over here at the Metro Toronto Convention Center. That document has been translated. I think Lise Gauvin told me this morning that it's been in 18 languages now. And the first recommendation from the Toronto Charter was that countries should develop a national physical activity plan. And in fact, many countries have done that. And so for the next 45 minutes, our first speaker, Dr. Adrian Bauman from Sydney, will discuss, I think he mentioned Australia, New Zealand. He's going to cover what Fiona Bull was going to talk about with regard to the UK. I consider Fiona and Adrian and Neville Owen from Australia as the three musketeers on physical activity and health from the land down under. So you'll hear what's happening from a global perspective from Adrian. John is then going to talk to us about the efforts in Canada with the Active Canada 2020 program. And following that, we'll entertain questions from the audience. So there will not be some questions after Adrian, but we'll do that when Adrian and John have finished their presentations. So without any further ado, Adrian.
Good afternoon, and thank you very much to Participation and the organisers for inviting me. I've been around physical activity for a long while and lived through a whole bunch of policies and plans, and I'll share some of those with you. In fact, I'm going to tell you about everything there is to know about physical activity plans and policies from a range of countries from my experience. I often talk with my colleague and friend Fiona Bull from Western Australia in sequence. Today I'm going to do the double act myself, and I'll use some of her slides, but I've adapted them a little bit to my perspective as well. So sincere apologies from Fiona Bull, who can't be with us today, and I'm going to be the replacement speaker. I'm going to start with why physical inactivity is a global priority, give you some principles of physical activity policy, give you some backdrop of the history or some of the landmark documents that have occurred over recent years, and then talk about physical activity policy in England, Australia, and New Zealand over the last 20 years plus, and then conclude rather abruptly. The problem is becoming global in all parts of the world. Non-communicable diseases are becoming the major cause of death in the world. Physical inactivity ranks fourth as the global non-communicable disease risk factor, the fourth leading cause of death, and ahead of overweight and obesity as a contributor to global mortality. However, our strategies tend to focus more on overweight and obesity than physical activity in most countries. Our Lancet Physical Activity series in 2012 estimated that 31% of adults are insufficiently active, meeting the guidelines of 150 minutes a week, but 80% of adolescents. So it really is a problem for kids in not meeting the guidelines, which for kids are 60 minutes a day. The health benefits are well known. There's a dose-response relationship. The more activity you do starting at quite low volumes, the lower your risk of developing all-cause mortality, cardiovascular disease incidence, diabetes incidence, or a range of other outcomes. For many outcomes, even moderate amounts of physical activity are beneficial, and that's where we get the 30 minutes a day or 150 minutes a week recommendations from. There are co-benefits. There are co-benefits to society, to community integration, to child development and academic performance. Kids are actually smarter when they're active. They do better in performance tests. It's not wasted time, it's beneficial time. There are environmental benefits of being active. There are transport benefits of less automobile and car congestion, better air quality, and there are economic benefits on absenteeism, productivity, and the intangibles of well-being. I'll give you the policy context in 2 slides and then we'll amplify it. The very first piece is that the health sector alone is not the effector arm of physical activity. But to define physical activity policy, it's a priority area with specific population targets which needs a plan of action. It needs something to drive it. And you get the different agencies, sectors of government, non-government, sometimes the private sector, and define their accountabilities and what they're going to contribute. You then have policy entry points in a whole range of sectors. Environment, there's a range of relevant policy pieces of importance to physical activity. Sport policy, economic policy, education, health policy, and social policy. So physical activity can impact or be driven by policies from a broad range of sectors. That's an important idea. And the kinds of physical activity policy can be environmental changes, natural experiments to build urban infrastructure or green space, the investment in mass media or social marketing campaigns, things like participation itself is a policy. There's a government policy that drives investment that says we want to keep pressure on the government, pressure on the community to take physical activity seriously. Schools are a setting for policies, environments, physical education, workplace policies, community policy testing, like some of the stuff I'll discuss in England, and primary care policies. Why do doctors, primary care physicians, always ask their patients about smoking, almost always measure their patients' weight, and tracked over serial surveys of GPs in Australia, almost never, and unchangingly never, rarely ask their patients about their physical activity levels? I've got 3 thoughts to start. The elephant in the room is that the word policy comes from the Greek word polis, which has the same etymological roots as politics. So why does it surprise us when policy is so strongly driven by politics? That's the first thought, and hold that thought throughout my talk because that's probably the most important one. The second one is that unlike simpler public health interventions, immunization of a population, the policy processes for diet, for physical activity are very complex and convoluted. So that we've got the Foresight report that describes the causes of obesity, and it looks like a map of spaghetti with causal factors and iterative recursive causal loops. any policy will only impact on a piece of that, one tiny corner, and you need a whole set of integrated policies to actually make change to population levels of physical activity for adults, children, adolescents, older people. So that's the second thought, is that a single policy won't fix the problem. And third, and I'll talk more about this throughout my talk, this is probably the theme of what I'm going to talk about, the variations in policy cycles. This is about the sports sector, but it applies to the health sector. Interest waxes and wanes in physical activity over time continuously. And for those of you young in your careers, think about the following question. How many policy cycles can you tolerate before you throw in the towel? Or how can we reduce the number of policy cycles to get it to go up and stay up for a longer period of time? And most of the evidence I'll give you today is about policy cycles. A little bit on the backdrop and some of the recent landmarks. About 10 years ago, I was involved as an expert advisor to the Global Strategy for Diet, Physical Activity and Health. We had 11 invited experts by the World Health Organization. There were 9 nutritionists and Cora Craig from Canada and myself from Australia, which partly reflects the disparity that we have in physical activity in the NCD space. We ratified the global strategy, and that started to generate evidence-informed guidelines for what countries should do. We wrote some of them in the mid-2000s. But what does physical activity policy look like 10 years later after the global strategy? Perhaps there's not enough action, but what are the things that cue action in a policy sense? They are global initiatives, state control, by that I mean public sector running policy initiatives, collective action as fundamental to public health, and market forces, which includes countervailing forces, and there are some things driving sedentary time or inactivity. The things that drive sedentary time are television and screens. Things that drive inactivity include car manufacturers, include the way society is structured to engineer energy expenditure out of our lives. So that physical activity is a neglected risk factor in non-communicable disease prevention. But I'm going to rewrite the middle bit because I think we've really had in physical activity global inertia, no control, complete inaction, and market denial. And that's a slightly different space for why we aren't progressing in physical activity. And Fiona and I have described physical inactivity as the Cinderella of risk factors, which we describe as poverty of policy attention and resourcing proportionate to its importance. You can describe it as Cinderella, but until it's reframed, our work is not done. It's Cinderella because it's not taken seriously. It's amusing, not life-threatening. There's no political champion. It hasn't got the health-motivating potential of hypertension or dyslipidemia. It should have, but it doesn't. We once tried, Frank Booth from Missouri, tried to define something called sedentary death syndrome, or SEDS. But it didn't fly, and it caused offense to the sudden infant death syndrome people at the time. But we need a way of capturing that it's a threat as serious as, at least as serious as, most of the other risk factors that we think about. And it doesn't have the evil vilification of the tobacco industry as an evil empire, or the emotive pressures on government by concerned parents with pictures of obese children. It doesn't have any of those motivating things. It's just being active, or it's elite sport, and both of those things are not taken seriously for health. So we started to develop things that made the case for physical activity, including the Toronto Charter, which we made here we led up to in the 2010. Fiona and I were strongly involved in that, so was Lise Gauvin, so was Art Salmon, the moderator of this session today. We needed a charter to guide a population approach and provide countries with a framework for action. It's actually been translated into 23 languages now, so it's increasing its usage across the world, and that's a useful frame for countries to start. The next piece are, well, what investments work? This was an evidence-informed review, not an evidence synthesis. And there are 7 investments that experts in the physical activity field deemed work: doing whole-of-school programs, transport policies, redesigning urban spaces, putting physical activity into primary care, public education, including raising community awareness and mass media, community-wide programs across settings, and sport for all. Which, the ministers of health have often asked me in different countries, should we do first? And the answer is, any of them that you actually do is the one you should do first, not the policy that you write intending to do them. There is almost no area where behavioral intention is greater than in the writing of policy compared to its implementation. There was the high-level meeting at the UN, the political declaration, but there was lots of work that went into that to get physical activity as one of the key areas considered seriously. A lot of advocacy went into the 25-25 agenda, 25% improvements by the year 25-25. And the actions suggested are all the things that we need to do cross-sectorally in physical activity. So we need plans. It's one of the key targets. It's one of the major targets. But if any of you saw the Lancet paper Saturday before last on the 6 major areas for NCD prevention and control, written by the NCD experts in the world, there was one area missing. And I don't need to tell you that it was physical inactivity. So there's a target, but there's a lot of advocacy still required. Okay, so some frameworks. What does a policy look like, and what should one look like? The Toronto Charter has at its heart implement a national policy and action plan. And the work surrounding that is the cross-sectoral work required to make that happen. 10 years ago, in a CDC meeting, which we had in Florida, we developed a framework where you've got a vision for an active world. You make the case because the epidemiological evidence is now 61 years old. It's older than me, and that's ancient. The causes of the problem are mostly known. We've got something like 3,000 to 5,000 correlates papers. We still don't understand much about what causes physical activity, which makes one wonder about all those correlates papers. We've got an idea of the solutions from the cross-sectoral work, and we need to implement them, and that's what policy needs to do. What kind of framework should you have? You could take a populations approach by population subgroups: older adults, young people, children, early childhood, people with disabilities, subgroups, older women, younger women. You can cut the population pie into segments and then target those with your plan, or you can take a strategy-based approach. What can we do or achieve with mass media, with individual behavior change programs, with creating supportive environments, with capacity building? Or you can take a settings-based approach. Let's do stuff in schools, in work sites, in primary care, in sport, in transport. Or you can take a sector-based approach, the different sectors of education sector, the health professional sectors, government at all its levels, national, state and local, national, provincial and local, civil society and NGOs, academics and the private sector. But it doesn't matter which way you slice the way you define your policy development. The most important thing is to do it. You choose which fits your context. Okay, and you need guidelines. You need physical activity guidelines. Most countries now have them. WHO's released theirs, which are on the left-hand side, the global recommendations that Fiona and I were involved in, and several others here, in 2010, putting together a distillation of the evidence for public health policy. So let's talk about 3 countries, starting with the UK. I think you'll see what I mean by a plethora of patchwork policies a few minutes from now. Policy started in the health sector about 22, 23 years ago with something called the Health Education Authority. At the same time, they had the very first National Physical Activity Survey, sponsored by Allied Dunbar, whom I think is an insurance company in England, of physical activity in adults. They had an Active for Life campaign, which was a 3-year campaign, first targeting adults, then older adults, then young women 16 to 24. And that campaign was a first strategy to raise awareness, particularly around the time of the Atlanta Olympic Games, with the new 30-minute message that had come out of the CDC guidelines in 95 and the US Surgeon General's report on physical activity in 96. There were 2 strands to policy development. One was in the health sector, and I'm showing that in blue, which started with the Chief Medical Officer's report and developed some specifications for kids. And the other was sport-related policy in England that actually was quite explicit about physical activity, but was quite strange at times. I'm going to start with the sport-related policy first, because it came from a different government department. Sport for All policy started in the 1970s as part of an equity approach which was going to get sport to all community groups, to disadvantaged and marginalized populations, and be a mass participation kind of thing. Many of those similar things were concurrent here in Canada with the early participation that Russ Kisby led. In the 1980s, though, the government focused on elite sport and what they called results-driven policy. And in 2002, they developed something called Game Plan that was a most unusually strange piece of policy writing for sport. It further refined elite sports manifestation, and it catalyzed the rhetoric of mass participation, but it really wanted to improve Britain's medal tally from 15th or 20th to 4th position, which was where Australia was, and they liked displacing us in all sports, so we took it personally, and they did. They succeeded completely and utterly. And they had other legacy promises: urban regeneration, active communities. But the most amazing statement that could have ever been said about a physical activity policy from a national body was a specific population target of increasing sufficient physical activity for health from current rates of around 30% in England to 70% of adults by 2012. Now, if I could see a 1% increase per year, I'd be happy to retire. But a 40% increase over a decade period was a truly outlandish presupposition. So the best thing policymakers can do when they make outlandish suppositions is do U-turns or distract the issue or change the measures that they're using for surveillance. And they did all of those things in England. Just to show you an example of their policy revisionism, not their surveillance revisionism, because they've had 4 changes to their physical activity measures in that period. In Canada, you are much luckier with a more consistent adult surveillance system. But Sport England in 2007 said their priority was to deliver a world-class community sports development system focusing on excellence in sport development and a tighter definition of sport. So, for example, recreational cycling, walking and going to the gym would be excluded from future definitions of sport. So having had the big physical activity target that was grandiose and imaginary, they say, no, we're going to be much tighter and not have any of that physical activity stuff, and we want elite sport, and then we'll have a different kind of target. So that's policy revisionism writ large. All of those words are theirs, not mine. So back to the health sector. So now you're going to see what I mean by a patchwork. Choosing Health in 2004 was a government white paper on public health. 5 themes in this policy statement, including active communities, active healthcare system, active workplace, local, regional, and national. So it was a clear policy statement. And sometimes it was mirrored at the local level, where the local municipalities would have responsibilities for targets and local accountability for delivery of some of the implementation of this. But one policy statement is never enough, because then you'd have to implement it. Isn't that what it's there for? No. Policy statements are there to beget policy statements that beget other policy statements. Then obesity became the focus, and physical activity became subsumed under the National Obesity Strategy. And again, British people were remarkably optimistic. Our ambitions to be the first major nation to reverse the tide of obesity and overweight by ensuring that everyone can maintain a healthy weight. Our initial focus is on children. By 2020, reduce the proportion of overweight and obese children to 2000 levels. We knew by about 2005 or 2006 that obesity had plateaued in children, so that was a safe bet. But the concept of then subsuming physical activity under obesity loses its identity a bit and makes it a narrower focus. But there was still some physical activity within the obesity strategy in healthy towns, in walking to health, in tools for parents to develop their campaign, in the National Child Measurement Program, and I'll talk about the 75 million evidence-based marketing in a minute. Different sectors produced different policy. Child-specific policy came out of the Change for Children, which has a different set of 5 outcome areas for physical activity. So we've got 2 concurrent national pieces of policy that are saying similar but not quite the same things and wanting everyone to implement it at the national and local level. It's starting to get confusing. There was a young people's plan that actually wanted everyone to focus on children, parents, and families, and developed a Play England strategy. Now that's a good idea too, because it's investing in public space, in infrastructure, in children's play facilities, but it's another arm of government developing another policy off in another direction. So where you haven't got an integrated set of policies, you're bound for a plethora of patchwork policies. Then, 2009, a new strategic statement, Be Active, Be Healthy, a plan for getting the nation moving. Produced by the Department of Health in collaboration with other government departments. We'll bring them together. An overarching policy linking all the different strategies that existed. But a comprehensive framework for the 2012 Games. So don't forget Game Plan that then became part of this. It set out 3 targets. To increase 1 million people from being sedentary to achieving 30 minutes of physical activity on 1 day of the week. Now that's a very strange target because there's no epidemiological indicator that says 30 minutes one day a week is of any benefit to anybody. So that's an interesting one. The second one helped 200,000 more people achieve 30 minutes 5 days a week. That's good, we know that. But if you look below in the blue, the sports sector interpreted that as 2 million more adults achieving 3 by 30 minutes moderate physical activity a week. Again, there's no epidemiological guideline on 3 by 30 moderate sessions. It's a hybridized derivative of the 3 by 20 aerobic activity recommendation from the 1980s. Be Active was focused on Be Healthy on adults and children. There were a range of strategies, including healthy weight, healthy schools. Updated guidelines. Fiona Bull led those guidelines in England, and they developed excellent guidelines for early years, adults, children, and older adults. A huge investment of time and resource. Excellent people involved. Mark Tremblay was involved in the children and young peoples. I can't see any other Canadians, but there were a few Australians as well. UK guidelines, launched in July 2011, guidelines across the life course. Media loved it. Attack of the nanny state. Now toddlers must do 3 hours of exercise every day. And the way the media then portrays this is to kind of make physical activity humorous, and it isn't taken seriously again. That toddlers, of course, not doing a push-up. More balanced coverage. The garden is perfect for exercise as long as you remember to stand. At the same time, another branch of government decided to do the Change for Life mass media campaign, large-scale campaign, £75 million. Focus was on making small changes, the nudge idea, no evaluation data, change of government in 2010 to a conservative government. Government outsourced the campaign to the private sector sponsors, including the food industry. much to the opprobrium that they received from public health, and it doesn't exist anymore. The Olympic Games brought a long list of promised policy legacies, and they're interesting things because they come from environmental regeneration, urban renewal, more Olympic medals, and maybe more sport participation. 2014, another parliamentary commission calls for action to get children moving, a national plan of action, which has getting the message out, designing physical activity back in your lives, making a lifelong habit, proving success. Another set of a different way of saying the same things that they've said at least 5 times in the previous decade in policy documents. They recommend a national action plan and be reassessed every 5 years. I interpret that a national action plan that's rewritten every 3 years. Political leader commitment to the national action plan, that's absolutely fundamental, but it hasn't occurred yet in the UK. A cross-sectoral departmental approach, yes, but you need to make the imprimatur that makes that happen, and an independent body to oversee and be accountable for implementing it. That's rarely done, because that's actually giving someone the task of making it happen. Okay, that's the patchwork from the UK. We'll look slightly more briefly at Australia and New Zealand. Both are interesting stories, but somewhat different to the UK. Starting with New Zealand, that is a small country, quite near Australia and sort of surrounded by not much else, has 4 million people, which is a very important idea in physical activity policy, because the countries that get physical activity policy right, Norway, Finland, New Zealand, have a small enough centralized government and then municipalities with none of this intervening state-province stuff, which gives us the third tier where things may get blocked or transmuted into alternate versions. New Zealand had a wonderful piece of policy called push play, which was the 30 minutes a day. That green symbol, green triangle, was relevant in 1999. Some of you younger people won't recognize it. It's the fast-forward button on a VCR player that's an antiquated device in which you slotted giant things to watch movies. It was recognized then, but it was led by the sports sector. Health was way behind in New Zealand at the time, by the Hillary Commission and then Sport and Rec New Zealand, had a campaign, a serious mass media campaign, really engaged with the Maori populations and the Pacific Islander populations in New Zealand, had a whole range of components, I'll show you some of them in a minute, had campaigns targeting parents, targeting kids, targeting the new 60-minute message, targeting fun and physical activity, mobilized the regional sport networks across the whole country so they were able to distribute things centrally across the country very easily, developed a whole bunch of resources, partnerships with NGOs and with other agencies that really became engaged, trained general practitioners with the Green Prescription Referral Program across the country. So sport development officers went to every GP in the country every 2 years, and in-service training was provided for them on the green prescription, on referring them to local programs, run by sport, but going directly to primary care and universally. So it really was a remarkable program, which was going from 2001 for about 10 years. It lasted 10 years, and then it was abandoned. And it's really sad that it was abandoned because it was a sustained, integrated, cross-national platform. And it was abandoned because there was a change of government in New Zealand and a Conservative government came in, and a Conservative government didn't want to do all this expenditure on community-based thinking and said it's more an individual responsibility and defunded it. The end. Australia's got a strange but somewhat similar story. No organised efforts before the 1990s. Our first plan was a state plan in New South Wales, where I chaired the Premier's task force on physical activity in the 1990s, which was whole of government, identified clear targets. That led to in the late 1990s, something called Active Australia, which was a federal partnership between health and sport, and to some extent education. That was the closest we got to a national strategy. But the sport policy was again in parallel, as in England. 1970s, community sports. We didn't do very well in the Montreal Olympic Games, so we got upset about that, so the rise of elite sport. The Institute of Sport was launched in 1980 to address this failure, of a national failure, was described as. The policy shift was winning gold medals, that was made explicit. The policy partnership then went the other way in 1998 to try and get sport and health together, but after the Sydney Olympics, there was a reversion back to elite sport, and the Federal Department of Sport went back on community participation and had greater investment in elite sport. Meantime, the health developments, we were influenced by the US CDC report. We had our Chief Health Officer communications. We developed best practice documents. But then in 1997, we developed Acting on Australia's Weight. And I'll show you, that's our obesity plan, and we were nested under obesity for a while. We did have some campaigns, the Active Australia campaigns, but only briefly between 98 and 2000, which were national campaigns on physical activity. Post-2000, went back to sport. We tried to get a document called Getting Australia Active across the country, but it was overwhelmed by the Obesity Task Force, the Healthy Weight Initiative, and those kinds of obesity phases. The Active Australia Initiative was therefore transient, only 2 to 3 years, much more transient than in New Zealand. And the partnerships were difficult to create. We worked with local government, we worked with municipalities. More recently, we've had a very large national prevention strategy with a non-conservative government. Our Labor government, 2008 to 2012, had a national preventive health strategy, had clear targets, again, obesity, smoking, harmful drinking, and closing the gap with Indigenous health were the key targets, but physical activity was well represented, well funded. About 900 million was put into this over 10 years from 2008, about 872 million targeting healthy children, healthy communities, healthy workers. And these were large strands of prevention. A lot of scaling up of physical activity interventions has been going on in Australia and has been escalating to a level that I'd never seen it until last Tuesday. And last Tuesday, our new Conservative federal government, 8 months into the term, abolished the National Preventive Health Agency and axed all the prevention partnerships, and every single program under those initiatives that was slated to go until 2017 will end on June the 30th, 2014, which is about 5 weeks away. So we're back to square one again. So PA plans fail when they have limited stable support, don't have good time frames, don't have role delineation and leadership and accountability, and don't have good evaluation of both their impacts and of their diffusion into the system. In other words, how well do they actually engage with all the places they need to get to? Our classic example is our Acting on Australia's Weight obesity strategy. We had a national plan that we all wrote in 1998, then nothing happened. Then we wrote another expert panel that was then abolished. Then we started writing another plan, Obesity 28, that was discontinued for the National Prevention Partnerships, and that's been disbanded. So it's not really acting on Australia's weight, it's really waiting on Australia's act. Because we've just had a cycle of adopting, and if you put all those policies in a backpack and everyone carried them around, that would at least be some resistance training for Australians. And there must be millions of copies of them sitting in sheds somewhere in the back blocks of somewhere. There are lots of other physical activity plans around the world the particularly good one is in Norway, where they've had a really better implemented plan across issues since 2004. Not going to talk about the US plan. Fiona wanted to mention there's a new policy audit tool that she's developed with HEPA Europe, which there are policy reports that describe the state of policy in a bunch of European countries, and it's now being used in some Middle Eastern countries. And the key factors for success are having a policy, having an implementation plan with the imprimatur and dollars to make it happen, and partnerships that will stick, and monitoring that will happen, and workforce that can deliver it, and leadership that can guide it. And without those things, then you're just writing policy plans in government. You need advocacy always to make this happen. The outputs of the policy audit tool are available on the HEPA Europe site, and Fiona Bull's led a paper in JPAR earlier this year with Karen Milton and Sonia Karlmeier. Okay, we need policy at multiple levels. We expect physical activity policy to go in cycles, but we need to change that behavior for us to make progress on policy. And my last two slides, what can we learn through scanning policy across the world in physical activity? We did this a couple of years ago, my colleague Bill Bellew. Most countries undertook consultations. Most tried to integrate physical activity and had multiple strategies. Most planned to work at multiple levels. Some countries actually developed those coalitions rather than just talked about them, and developed a clear identity or brand for the initiative. Because the problem we have in Australia that you share in Canada is a national program, and then the state program, and then the local program, and then another state program, and the community gets confused. You need national clear physical activity guidelines. Some countries have got that. Few have defined responsibilities and accountabilities for the partners and given it sufficient time frame for action, not time frame to next writing of policy. Few could articulate specific activities they were going to do in the next year, and few lasted more than a couple of years. And few or none established a systematic approach to monitoring and evaluation, and arguably Canada's been at the forefront of actual physical activity surveillance through a whole bunch of your physical activity monitoring systems. So you know where you are by, is it started? Are you developing a plan? Are you getting it finished and getting it going, not writing new plans? And then are you ensuring implementation? Those are the stages. Otherwise, what comes next in policies in physical activity and sport around the world, this is my last slide, is Back to the Future and Groundhog Day. Thank you.
Well, a great start. Our next speaker, Dr. John Spence from the University of Alberta, will give you some background on where we are in Canada with the Active Canada 2020 plan. Canada has never had a national physical activity strategy, a formal strategy endorsed by various levels of government that I was just talking about. We've had blueprints for action in the late 80s, early 90s. We've had national guidelines that have just been updated recently by the Canadian Society for Exercise Physiology. We have a surveillance and monitoring system that I would argue unabashedly is one of the best in the world, between what happens to the Canadian Fitness and Lifestyle Research Institute and Stats Canada with the Canadian Community Health Surveys. But we've never articulated it together in a plan. And some of us that have been at this for quite a while got a little impatient coming out of the 2010 International Conference on Physical Activity and Health, and decided that perhaps if the federal government and the provincial territorial governments in Canada weren't prepared to put one together, that the physical activity stakeholder community would. And thankfully, with the support of Participaction and their national advisory committees, that work has been underway. John has been taking a lead role in the development of that plan, and specifically with his team of researchers on the evaluation and monitoring of it. So without further ado, I would introduce John from the University of Alberta, from the Faculty of Physical Education, or Physical Activity, I guess, and Recreation. For those of you who are following hockey, you have to give John just a moment. He is, what did he call himself? He's a member of the Habs Fanatics Network. And unfortunately, they're down 2-0 to the Rangers right now, so he's a little subdued. But nonetheless, John?
Yeah, just a minor setback there. I'm sure they're going to come back. So yeah, I was, I guess. Actually, so Adrian and I had not even discussed our two presentations. We had a general idea of what we'd be talking about, but I think that you'll see that my presentation segues quite nicely with what he was talking about, and particularly the sort of history of policy development in England. It would match very closely, almost to the date at which policy and policy papers were established in Canada. If I had a subtitle to my presentation, it would be something like How to Herd Cats. Canada doesn't suffer from a lack of policies and frameworks, but it was, as what Art was saying, what we do suffer from is some coordinated approach, some implementation, some sort of action plan, and that's what I'm going to talk to you a little bit today about Active Canada 2020. First, I just want to acknowledge several individuals who've contributed to the development of the plan. There's many others too, but Krista Costas-Bradstreet from Participation, who couldn't be here today, has played a major role in this. Dr. Guy Faulkner from University of Toronto has been working with me and leading the development of an evaluation plan for Active Canada 2020. And then the advisory groups from Participation, as Art mentioned, there's a research advisory group, and then there's something called the Content and Capacity Building Advisory Group, which consists of practitioners, provincial government people, and representatives from NGOs. And they were the ones that really drove and really pushed for this as members of Participation's advisory group. And so that's who we have to thank today for this. Okay, so I'm not going to touch too much upon prevalence data and so forth, but I think this slide that you see up here is very consistent with the report card data that we heard this morning by Dr. Tremblay. What it depicts is energy expenditure over the last 50 years or so. This is from US, and it's also proportioning out the types or the sources of that energy expenditure. You can't read the fine print there, but the big chunk at the bottom, the polka dot, is occupational related activity. Then the dark one in the middle is domestic related activity. Then the white bar, the third one up, is transportation related activity. Then the stripes are leisure activity. And then the black line is sedentary time. So it's depicting out, you can see out over the next 20 years, where things will be at there. The main thing to take away from here is energy expenditure has decreased across over time, over the last 50 years, and sedentary time has increased. And I would argue this is a very natural thing for human beings. So what we're dealing with here, and it will not be addressed by solely just increasing leisure time physical activity. So any type of policy framework they're putting into place has to take into account the different sectors, settings in which we engage in activity or do not engage in activity. Adrian talked about the Toronto Charter, and that was the major initiative for us with Participation to start discussing the need for some sort of national policy and strategy around physical activity. And as he had already talked about it discusses the need for these things. He also touched on the definition of policy, and what I want to point out here was that it states that there's specific population targets and provides a specific plan or framework for action. And that's what we feel was lacking at a national level. I'm not going to get into tons of detail of all those different policy initiatives there. I'm just going to touch upon a couple in Canada. that I think were important. First of all, it's important for us to understand that most of policy around physical activity really lies at a provincial or maybe even a municipal jurisdiction. So that if we're going to engage in these kind of discussions, we need to be thinking about, as Adrian mentioned, that third tier that gets in the way oftentimes, the state or provincial politics. Probably one of the most important policy documents to date in Canada, and Art would be much more of an expert on this than I am, would be the Blueprint for Action that came out in 1987. And the reason for that is in that report, there literally were these implementation or action plans that were being identified. And so it could help with that implementation intention gap that Adrian was talking about before. Unfortunately, very similar pattern as what we see in England. Times change, new governments come into power, new reports are released. In 1997, the FPT policy paper on a framework for action, around that time, we saw a reduce, in fact, almost complete reduction in funding for the Blueprint for Action approach. And there was much more sort of a provincial focus on how we were going to drive physical activity in the country. We actually have legislation, Bill C-12, on physical activity in sport, and you'll notice it's in 2002, which is exactly, I think, the same date as Adrian was talking about in England, and there was a focus in there encouraging this mass participation sport for all. But really, there were also an interest in sport development in that legislation. So I'll just give you a couple of examples of policy initiatives, one that I think is not a very successful one, but it's very popular with both the federal and provincial governments in Canada. And this is a tax credit for children's physical activity. So if your child is registered in a physical activity program that has a cost associated with it, you can declare this when you go to submit your income taxes at the end of the year, and you can get a tax credit of up to $500. Which might turn out to be about $75 that you'll get back on your taxes at the end of the day. The real issue with this tax credit is that you have to, A, have the money to spend on your child to register them in a program, and you have to spend up to $500. So what this graph here shows us is that it's the high-income families in Canada that are most likely to claim this credit, and the low-income families are the least likely to be claiming the credit. And on top of that, they might not even qualify for the credit because they may not be paying taxes at a sufficient level to warrant receiving the credit. So here we have an initiative, I'll show you later on, but it's costing us hundreds of millions of dollars, and it's basically going towards middle to high income families and probably not addressing the issue of low physical activity or sport participation relative to an income gradient. So what is it? Well, federally, the blue bar here is showing you what is actually spent, or the income that is not taken in as a result of the tax credit by the federal government. And in 2010, it was up at almost $120 million. So it's about a $50 million shortfall from what they were projecting out originally in 2007. So they were willing to forego $160 million in tax revenue to support the credit. I would argue that if you could give us $160 million, we might be able to do something more effective. So the issue here is there's no evidence of effectiveness of the credit increasing activity levels, but there is evidence of inequities. And so it makes you scratch your head and wonder, what is the real reason for providing these tax credits? It's definitely not to increase physical activity. Provincially, we also have tax credits in several provinces that amount to about another $100 million in income revenue that's not being taken in. So somewhere around approximately $200 million we're spending in Canada for tax credit programs, and there's very little evidence that they're actually effective. You won't be able to read the fine print up here, but this graph is depicting the proportion of municipalities, large municipalities in Canada, that have at least one bylaw that restricts physical activity. Riding your bike on sidewalks, skateboarding in public places, and playing in the streets. Now, for those of you not from Canada, playing in the streets may not seem like a very smart thing to be doing, but it's part of our national heritage that you play street hockey, or it used to be. You don't see it so much anymore. And so, there's this very romantic notion that our kids are out playing street hockey. Well, there's actually a majority of municipalities have a bylaw against that. So the orange bars at the bottom, the longest one there is at least one municipalities have at least one of those bylaws, and the bottom one shows that almost 60% have all three of those bylaws in place. And every once in a while we hear about them in the news. Someone in the neighborhood has called the bylaw officers about these things. So this would be another example of policies that are in place. They're not there to promote physical activity, but they're potentially restricting physical activity and be inconsistent with any national plan that we might want to put in place. So Cora Craig, in an excellent paper, Adrian mentioned her before, she used to be the head of the Canadian Fitness Lifestyle Research Institute, wrote a very good paper on examining the policy process in Canada. What she tells us there is there's actually a host of policies that have been existing ever since Confederation, actually, so 1867. And that these policies are multi-jurisdictional, multi-strategic, and have involved various different sectors and provinces and jurisdictions. Again, similar to some of the things that Adrian has mentioned. She identifies that in almost all the cases, or virtually all the cases, these policies were developed as standalone strategies, which might be a good thing because then there's clear leadership to be taken there. On the other hand, we would argue that the problem is we've already identified that physical activity, inactivity is probably a multi-jurisdictional problem. And so as a result of that, we have health developing one policy, sport developing another one, recreation developing another one, and perhaps that contributes to the that crazy herd of cats that's running around out there. But her conclusion in this paper is that the sum of current policy initiatives is inadequate to increase population physical activity in Canada. And so this is the starting point for us in terms of Active Canada 2020. There was a sense that there's a lack of leadership and coordination at a national level. And as I mentioned before, this was born out of Participactions Advisory Groups, which has, I would argue, a very knowledgeable set of individuals representing the main sectors, including research, academic groups, NGOs, provincial government representatives, and others. We engaged in a very sort of systematic process, lots of consultation done, online surveys of an original document. Probably I would say the most extensive part of this process were stakeholder face-to-face consultations held in 12 of the 13 provinces and territories. And again, if you're familiar with the size of Canada, that's a massive undertaking. This included the territories, Yukon and Northwest Territories, and then none of it was, I believe, an online consultation. So overall, there was approximately 1,700 Canadians who were consulted in the process. I took part in 2 of them in facilitating them, and there was very good participation from my observation, and people were really coming in there with a willingness to engage, and were hopeful about the process and the outcome. The vision from Active Canada is, Active Canada 2020 is that a physically active lifestyle helps define Canada and strengthens the health and social fabric of our country. And the goal statement was to increase the physical activity level of every person in Canada. So ambitious. The crux of Active Canada 2020 is the areas, what we're calling the areas of focus. So these were the areas that were going to be addressed, and then the foundations. These are the resources and the supports that we saw that were required for it. I'll touch upon the areas of focus now briefly. So the first one was policy development, change, and implementation. So this would be consistent with the Toronto Charter, the idea that we need to either be introducing or changing or coordinating the implementation of policies. And in particular, what we're thinking about here is the provinces and territories. Many of them already have some sort of a strategy or a plan. Some of them we're looking to revise them. And what we were hoping for is this could be done in a more coordinated manner, so that we had consistent goals, for instance, being identified, and perhaps action steps that to some extent could be consistent, but still recognizing that there are unique geographic, for instance, differences in the different provinces and territories. Targeted information in public education, so there was recognition that this was necessary, but by far not sufficient. And we have some good programs in Canada, including things that Participation has done over the years. But definitely we see this as being a part of this plan. High quality, accessible programs and services. Again, huge variations as we go across the country in issues around access. And so we heard loud and clear from our consultations that this was an important consideration. And then community design, so shouldn't be a surprise, again, going back to some of the things that Adrian has talked about. Looking at built environment and access, and again, huge differences between the north, rural areas versus urban areas. In the urban areas, the car culture is very dominant, for instance. So within each one of these areas, there were more specific action items that were identified. I'm just giving you the overview of what those areas were about. The Foundations for Change, 3 key things here, probably not a surprise to you. One that was identified is the ability to be able to evaluate and engage and participate in knowledge exchange. So we need an effective surveillance system, and then the ability to be able to translate those findings into useful information. Strategic investments. This is probably one of the major failings, as Adrian has identified, for other policies and plans in other parts of the world. Not necessarily asking for new money. For instance, if we could go back and pull that $200 million that we're already spending on tax credits, we probably would be able to fund much of what would be required to have an effective Active Canada 2020. And then mobilization, the ability to be able to engage with our leaders and to be able to move things along. And that's really what we're hoping this is. It really is a call to action. So the way we sort of started that mobilization process was we held a national gathering last year in New Brunswick, and it had as its goal to create this momentum. We were getting the provinces to be aligning their strategies, or hopefully to be aligning their strategies with Active Canada 2020. And we were able to engage representatives from each province and the NGO sector in discussions with a couple of purposes. One was to develop strategies at the provincial level, or revise them, or get them in the process. Second was to identify what we called action groups. So these were several topic areas, or several areas that we saw that we strategically needed to move along, and I'm going to touch about those in a second here. So the representatives from the various provinces got together. They spent most of their time at the tables with their provinces or territories, and they were tasked with several things, and one of them was that they had to do a scoping exercise. So the way they presented the results from that scoping exercise when they arrived was that they had developed posters, and if Anthony Card's in here, he's the guy doing the little muscle man up in your top left corner there. Newfoundland had the most innovative and poster, I think it was an agreement. Unfortunately, I don't have a great picture of it, but it's a big bicycle identifying strategies related to promoting active physical activity in the province. So the provinces were there making a commitment to action. Then the active action groups that we identified, these were cutting across jurisdictions, were active transportation, accessibility and diversity, schools, and active play. And there were individuals who were identified to chair each one of those groups. And those groups have been meeting, and several representatives from those groups, I think, are here today. And the idea is they're going to be helping to move these sort of, I said, cross-jurisdictional, cross-provincial things along with the provincial strategies. Then the third thing was this one cause for action that we saw, and that was the need for a physical activity policy for Canada. So those were the things that were coming out of the national gathering. This is how we were hoping to get the ball rolling, part of that mobilization process. There's an implementation framework that's been drawn up for it. Apologize again, probably for those of you in the back row, you won't be able to read this, but the key things in here are that we have the provincial strategies moving along. Several provinces or territories since the national gathering have been doing work on this. BC is heavily involved right now in a process of developing a provincial strategy. Yukon and Northwest Territories are looking to develop one. And Newfoundland, I was just recently at a meeting in Newfoundland where they're looking at and talking about developing a strategy. So the hope is that they will then be using things like the Toronto Charter and Active Canada 2020 to guide the development of those strategies. Yeah, that's what I want to say there. Okay, so Adrian, I think, touched upon some of this stuff before, but if we look at where we're at right now relative to some criteria of what a successful policy or action plan would look like, we would say we've probably checked off many of the items on this list. So we've been done extensive consultation, we've taken this sort of comprehensive approach, we're working at a different level, but there's probably a couple of things on here where we're not sure where we're at. One is the development and implementation of the policy and action plans across multiple agencies by working through coalitions, alliances, partnerships. That's the stuff that we're just hoping is going on now. Similarly, the integration of the physical activity policy with other related agendas, that remains to be seen, but we hope that's going to happen. So if a national organization is going to be developing their obesity plan or their diabetes prevention plan, we would hope that the tenets of Active Canada 2020 would be represented. There's no sense in duplicating the process. Other items on here, other ones that we would say we're not sure about now is the stable base of resources to implement the policy and action plan. And this is critical, absolutely critical. We need some commitment at municipal, provincial, and at the federal level in terms of supporting these things. For instance, the ongoing surveillance costs quite a lot of money, and we would hope we have a commitment to maintain that. Otherwise, it's very difficult for us to evaluate the effectiveness of the implementation. Similarly, the evaluation and policy or specific plans and resources for evaluation, that is in the works right now. And as I mentioned, Dr. Guy Faulkner is involved in helping to develop these. So for instance, a logic model that we're working with right now involves looking at the initial outcomes down on the left corner there of the provincial plans and strategies, the efforts of the action groups, and so those efforts we're hoping to be able to evaluate, articulate what those are, measure them, with the ultimate outcome of seeing an improvement in the level of activity or inactivity in Canada. So, in conclusion, we think that we have engaged in a process that is inclusive, has been comprehensive. As I said, we consulted with over 1,700 Canadians, experts in a wide range of areas. And I think the key thing for us now is that if the plan, the strategy, the call to action, whatever you want to call it, is taken up at multiple levels by all sectors, then we think that we can be effective. But, you know, it's like in those logic models, you have your if-then statements. We can, as Adrian said, there's best of intentions in our policy statements, but we need the actual action to be implemented to bring about some type of change. And if you want to learn more about Active Canada 2020, please go to the website, and we'll be interested to hear what you have to say about it. And I really hope that for the Canadians in the crowd, that we can have your support in helping to move it along. Thank you.